In this video, I am going to discuss the role of dual energy CT in the evaluation of pulmonary thromboembolism using iodine mapping. Iodine mapping has got different names in different manufacturers. Siemens calls it pulmonary blood volume or PBV. In GE, it is called lung perfused blood volume or iodine mapping, and in Philips iodine density mapping, and in Canon previously Toshiba first pass perfusion or iodine mapping, United Imaging iodine mapping, and Hitachi shows it as dual energy iodine mapping. Let's move on to each cases. Case number 1. Here we have a dual energy CT showing perfusion voluming or iodine mapping. What you can see here is complete filling of the lungs with red color, which is perfusion or iodine mapping, which is filling entirely both lungs with no evidence of any reduced perfusion or perfusion defects. So this is likely to come back as normal CTPA. If we look on the CTPA imaging, there is no evidence of PE, and in the lung windows, the lungs appear quite clear. Let's move on to the next case, case number 2. This is another case which shows another normal iodine mapping completely filling all the lungs. So what is important in these kind of images is to see this increased iodine mapping in the region close to the pulmonary artery and aorta and close to the SVC, which is increased iodine due to artifact. So we need to be aware of these artifacts. This is another case of normal perfusion, and the CTPA shows no evidence of PE, and also in the lung windows the lungs appear quite clear. Let's move on to the next case, case number 3. Another case of iodine mapping. As we see in the upper lobes, there is significant increased iodine mapping due to adjacent contrast filling. That is an artifact. As we come lower down, we see a large perfusion defect involving the right lower lobe, and also you can see there is a large thrombus sitting in the right descending pulmonary artery extending up to the right main pulmonary artery. This is very well appreciated on the CTPA as well. Let's move on to the next case, case number 4. This case shows normal perfusion in the upper lobes and also artifact from the adjacent contrast. As we come lower down, there is a moderate sized perfusion defect in the left lower lobe, and we can see pulmonary thrombus sitting in the left lower lobar pulmonary artery, which is much better appreciated on the CTPA, showing a large thrombus. Moving on to the next case, case number 5. So here we have got iodine mapping, which shows complete filling of the lungs with no evidence of reduced perfusion or perfusion defect. But as you can see here, compared to the left upper lobe, the right upper lobe shows multiple areas of non-filling, which are not wedge-shaped and are predominantly in the medial and mid-third of the lung. So I know looking at the perfusion scan itself, the lungs are abnormal, especially in the upper lobes, that too in the right upper lobe. When we see here, we see extensive emphysema, and you can clearly see the emphysema in the right upper lobe is much higher than the left upper lobe. So in a way, iodine mapping helps us to look at which lung is more abnormal and helps in making better diagnosis. So in summary, I would say dual energy CT scan with iodine mapping is a very valuable tool. Although there is a slight increase in the overall dose, it will help us to arrive to diagnosis much quickly so that our reporting time is less, and also helps us to identify which lung or which lobe is likely to be abnormal when we are trying to look on the lung windows. So briefly, I have shown cases of 5 cases of dual energy CT iodine mapping in patients with suspected pulmonary thromboembolism. 2 cases were normal, 2 abnormal, and 1 case where there is no PE, the lungs were abnormal. I hope this video helps to implement dual energy CT